I've been joined in studio by one of our finest from here to the rest of the world, the dentist par excellence, who will be talking to us about dental care and how to take care of your teeth, and particularly how to get out of the domain of halitosis if you already have it, and if you don't have it, how not to get in there. Dr. AC Affle is my guest. Doc, welcome. How are you doing?
Thank you.
Good to have you.
Fine, thank you. How are you also?
You look very well.
Thank you so much for having me here. And I'm always happy to, spread my knowledge, inform Ghanaians especially on how to take care of their mouth.
I see. I see you brought some, are they gadget equipment or apparatus or
These are all
ingredients?
useful in cleaning your mouth.
Okay.
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 So on the right, I'll start with the right. We have.
You'd have to lift it for me
Sorry.
so they can see.
So this is an interdental cleaning device. It's called a floss.
Floss.
Okay.
Okay.
This floss is attached to a pick.
Okay.
Okay. And then we have the floss that is the string type that you can pull and tear long enough to clean in between your teeth.
Okay.
And another interdental cleaning device is this. We call it an interdental brush.
Okay.
Okay. So for those who do not have that great manual dexterity, like the elderly, they can use this to clean in between their teeth, and those who've had their gums drop down.
Okay. Okay.
And then I have here different types of toothbrushes. I have a soft toothbrush, and then a hard toothbrush.
Why do you have a soft and hard toothbrush? Guide me.
Well, it's very easy to find hard toothbrushes on the market, and most Ghanaians go for the harder option because they feel they need to scrub to get the dirt off. But there are implications to brushing too hard and using a hard toothbrush that a lot of people are not knowledgeable about. Hard toothbrushes wear away the outer covering of the teeth along the gum line, and this can lead to sensitivity. Okay.
So when I go to the market, for example, what kind of toothbrush should I be looking out for?
So you want to get a soft or a medium toothbrush.
Okay.
Never a hard.
The ones that are like scrubbing brush, you say they are not good.
No, not at all.
They damage the teeth.
Yes, they do.
Okay.
They really do hurt your teeth. So what a lot of people think is, there are deposits around their teeth. If they scrub hard, brush with all their the force, the strength that they have, and then they also get a hard toothbrush, it will take the deposits off. But what they don't know is that once the deposits have hardened, they calcify. So they've become really hard. Your toothbrush cannot take it off.
What takes that off?
So we have in the clinic professionally, dentists have ultrasonic scalers. They are tips that vibrate and break off the dirt around your teeth. So
it's not a hard brush that does the trick.
No.
When you notice anything unusual, you have to go to the dentist.
Exactly. It's not even just when you notice anything unusual. You have to visit the dentist 6 monthly because that's the duration at which the deposits harden.
That's twice a year.
Yes, please.
Wow. I see. How often can you keep your toothbrush?
So you should change your toothbrush at least three months in a year. Every 3 months you change your toothbrush.
3 months?
Yes. But you see, that's why most people go for the hard ones.
For the full year, the brush opens like that and they still use it.
No, yes. So it should be 3 monthly, but then if your brush is looking old, you should change it. So it's not that the bristles are frayed and then you are still using it because you are waiting for 3 month mark. Once it starts looking old, you should change it. But then if it starts also looking old too early, after 2 weeks, it's already looking too bad. That means you've been using too much force.
I see.
You've been scrubbing. And that's why it's good to, use a soft or medium because then it shows you how much force you are using early. But then when you use the hard ones, nothing happens to them. They remain the same throughout the year.
You can go for a full year.
Yes, without having to change them. So yes, they are affordable, but they are dangerous.
They're dangerous. I see another thing you have there.
Yes, so
you have to use a soft or a medium hard brush. Can I say that? Or medium?
No, soft or medium toothbrush.
Okay, all right, sure. So what's the other thing we see
these
there?
are tongue cleaning aids. Okay. So this is a tongue scraper.
You would have to lift it for me. So
Oh, I'm sorry.
Okay, tongue cleaning aids.
Yes, so these are tongue scrapers, okay? There's the plastic one and then the metal one.
Okay,
These
okay.
are for cleaning your tongue.
Okay.
So when you
Are
finish,
they on the market?
they aren't that easy to find.
Okay.
In our clinic, you can,
Okay.
but I'm sure in other dental clinics as well,
You
you'll
can,
be able
okay.
to.
So
get
how is
them.
this one used?
So let's imagine this is your tongue, okay?
Okay, right.
After brushing your teeth, you want to clean off the white
Okay.
deposits off your tongue. So you scrape it off
Okay.
and then rinse it under the tap.
Okay.
Okay. So you look in the mirror when you're doing this. You make sure you go get all the parts that have white
Okay.
or discoloration.
Okay,
Your
okay.
tongue should be majority pink, like
Okay.
have a pinkish.
Pink spread.
Yes, exactly. But you also don't want to do it too hard, such that
happens?
you start bleeding.
Okay.
Yes.
Okay.
So a lot of people.
So you have to do it again.
Oh, sorry.
Okay.
So you
Right.
go like this and come forward.
Okay,
Okay. Make
okay.
sure you get all the white deposits off. Rinse it under the tap and then go back again.
Okay.
So these are not, like you said, are not easy to find
Fine.
on the market.
Okay.
But what we have is brushes that have designs at the back.
Okay.
So these are inbuilt scrapers.
Okay.
So
they have are they dots or what?
yes, so they are a mix, different types.
Okay,
So
okay.
this one is more like wavy. Okay.
So when you see that at the back of your brush, it's not for decorative purposes.
No, it helps
Okay.
you clean your tongue.
Ah,
so
I
your
see.
brush itself, the bristles can clean, but
Okay.
they're usually not as effective.
Okay.
In getting, because there are hairs on your tongue that trap the particles.
Okay.
So these hairs make it harder for your toothbrush to get everything off.
Okay.
So you need something slightly more,
Right. Okay.
slightly stronger that would go and then
I
take
see.
the deposits off. So
Right.
when you finish brushing, you turn your toothbrush and then you get all the deposits off.
I see.
But then if you also don't have access to this, you can just use a normal spoon.
A normal spoon.
Yes,
I was
so everyone
wondering
has
what the spoon was doing here because we're not drinking cocoa.
Everyone has a spoon at home.
Right.
So you moisten the spoon, put it under the tap for it to get wet, and then you clean the top of your tongue. And you should do this at least twice a day.
At
So
least
morning
twice a
and
day.
evening.
Okay, when
so
you
whenever,
brush.
yes, exactly. So when you're in a hurry going to work, you brush your teeth, but always forget to do your tongue. 90% of bad breath, if it's originating from your mouth, comes from the deposits on your tongue.
I see. Wow. Then takes me to the question. Some people are in the habit of brushing just once a day. What are they in for?
Well, there's a saying, brushing in the morning helps you keep your friends, and brushing at night helps you keep your teeth. That's because the deposits around your teeth at night stay there throughout the night while you are sleeping.
Okay.
And saliva production at night is very small compared to during the day when you are active and moving about.
Okay.
So when the deposits stay on your teeth or around them, and the saliva is not enough to wash away the food, bacteria works on the deposits that are left there.
Oh, okay.
Yes.
Okay.
So bacteria produces acid that wears away the outer covering
Okay.
and then leads to holes forming in your teeth. In addition to that, there are sulfur-producing bacteria
Okay.
that work on the food particles and then give out the bad smell. That's why when you wake up in the morning, your breath is not the best.
Right.
Before you brush, you don't want to really talk to anyone.
Morning breath.
Yes.
I see. Now, there are also people who say, oh, I brushed last night, so why waste my time this morning brush? Let me just rinse my mouth with, what do you call it, a mouthwash and go to work.
Okay, so mouthwashes just act as an adjunct. So they just help the toothpaste and the brushing. But you don't just take mouthwash and then rinse out because also during the night, there are deposits that stay around your teeth. And if you do not wash these deposits off, even though you brushed at night, they are going to stay, they are going to thicken, and they are going to harden.
Okay, I see. Halitosis. Let's talk about it. Bad breath.
Okay.
How does it come about?
So there are different types. It's categorized mainly into the real halitosis, where your mouth actually smells, and then the imaginary one, where you think your mouth smells, but
Okay.
it really doesn't. Okay.
I'm sure a lot of people have noticed what their problems are since we started using face masks.
Yes, exactly.
You will
That's
choke
true.
on your own supply.
Very, very true. So everything that comes out comes back to you. So you realize your mouth smells. But to some extent, everyone's mouth smells. Okay. That's why we have to classify it in this way. So the real halitosis is when you have it coming in the morning, for example, or when you haven't drank a lot of water. Because when you haven't drank a lot of your water, your mouth becomes dry.
Okay.
And once your mouth is dry, the gases that are in your mouth now come out and reach other people. Okay. So it's very good or important to stay hydrated, drink a lot of water every day. And so if it's coming and it's natural, when you brush in the morning, it would go. But then there are other causes of bad breath that come from your mouth. Okay. There are also others that come from outside your mouth. From within your mouth, we already tackled it coming from your tongue. That's the major source. But then there are also deposits around your teeth that I mentioned that track around and go down.
Into the corners.
Yes, into like below the gum line. Once they go below the gum line, they now pull bacteria with it. Bacteria breaks down the supporting structures of your teeth, creates little gutters around the teeth, and then more food gets in and, causes more problems.
So for meat lovers, people who like to chew meat and they chew the meat, it's stuck in there, they don't have the floss, so they ignore it. Are they up for halitosis?
Yes. So like any when food rots, it smells. Okay, anywhere you put food, if you don't attend to it for some time, it starts smelling. So in the same way, if you have food in between your teeth, you don't clean it out, it's going to start smelling. Okay. Also, in addition to that, I mentioned that bacteria works on food deposits left in between your teeth. The acid that is produced now spread in between the two teeth. Okay. So let's take an example here. So if you have food getting stuck in between here, so here, the infection will now track in between the two teeth. Now those ones are harder to.
You need to do that again for me slowly. Yeah, that's your camera. The camera here. Okay.
So if you have food deposits here, stuck here, the bacteria work on the food, and now the food starts tracking in this direction, versus if it is on your teeth. If it's on top of your teeth, then you see the holes this way. So you see the holes, and when you look in your mouth, you can see there are holes. But then the ones that are in between your teeth, it's harder to see. So what we find it easy. We see it as a grayish discoloration. We may need to take x-rays to show you that this is really what is going on. And the progression when it is in between your teeth is much faster than when it is on top. Not saying that the one on the top means you can take your time. Yes, exactly. Yes, because the tooth has 3 layers. There's the outer covering that's if there's any infection, you don't really feel anything. Then there's the middle part where you feel sensitivity to hot and cold drinks. And then there's the innermost part where there's pain. Now, there are people who have high pain tolerance and there are people that have low tolerance. So those with low tolerance will come quickly and say, my tooth is hurting. And then we get to fill it before it gets to the innermost part. And then there are some people that don't feel anything till it becomes painful. And once it becomes painful, the treatment moves from becoming a normal filling to a deeper root canal filling.
I see. So how do we prevent halitosis, for example? Or how do we cure it? Is it curable?
Well, it depends on...
Is there help for...
Yes, so it depends on where it's coming from. Okay, so if it is coming from within your mouth and you've never been to the dentist before, it's clear that you have to visit, get your teeth cleaned, get your holes filled, and then let's teach you how to clean your tongue. Then we can reassess and then say, okay, it's gone, it's better, it's improved, keep these practices and you would be fine. But if it's coming from, let's say, a condition within your body, like for example, if you have diabetes or an organ that is slowly failing, the chemicals released through these processes bring out gases. Okay. So then it draws our attention to the fact that, okay, your mouth is fine. There's nothing really going on.
It's something from somewhere that's coming.
From somewhere. It could be from your nose. It could be from your throat. And then we then refer you to an ENT specialist, ear, nose, and throat specialist for further management. And then there are people who always imagine that someone moving away from them means that their mouth smells. Yes, those people are...
Such people win all arguments.
Yes. So those people have some kind of psychological, concerns about their mouth
that
smelling.
People think my mouth smells.
Yes, exactly. And surprisingly, these are the people that when they come to the clinic, their mouths don't smell. So funny enough, the people who have bad breath come and then they're fine. They're like,
confident.
I want to. Yeah, confident. And then the people who are who don't really, because we assess it based on the smell that comes out. As you're talking, we'll be, trying to smell anything within a close range. Yes. And you see that they are really disturbed, but majority of them don't really have a problem. They don't, and you'd see that they brush too hard. They clean, their mouth is like 100% clean majority of the time. And then they still think it does. So they move from clinic to clinic trying to find a cure. And so for such people, we need to refer to a psychologist, or a counselor.
I see you didn't bring a toothpick.
Well, this is a toothpick.
This is a toothpick, but this
to
is
some
not
extent,
like,
but this is plastic.
Yeah, but this is not the woody one we see at the eateries and the choppers.
Yeah, so the wooden ones, what they do is they end up traumatizing your gums. Okay. So even this, I don't particularly advise you use this side. This is the best side. And for this type of floss, I would say use it more in the front area because that's where you can move it left and right because you are flossing to, get the deposits from the sides of your teeth. So this is how it should be. It's like you are cleaning or brushing, the sides of your teeth, and then you go to the next side, and then you brush that side as well. So it's not just in, out, in, out, in, out. Okay, but for the back teeth, what you notice is that it's hard to, get this all the way. That's why there's this one. Okay, but this one needs some practice and. It's very easy. Yes. So you roll it around your middle finger till you have very little, this much. And then you go in between your teeth. Okay. So you go left and then right. Okay. And then left and then right. Right. Okay. Yes. So this is harder to use, but it's more effective all around your mouth.
What's the best way to brush your teeth?
Okay. That's a good question. So the best way to brush your teeth is to hold the toothbrush at an angle between your gum and the tooth. Okay, so you won't be holding the brush like this because
like a dagger.
Yeah, like this because what it does is it just does the teeth. Okay. A lot of people think that when they bleed when brushing is because they brushed their gum. So they think they've hurt their gums. But then when your gums are bleeding, it's more because they are unhealthy. When your gums are unhealthy, they bleed when you brush because there are deposits with bacteria working on the gum, irritating that area. So you want to brush as close as possible to the gum and the tooth. So you are almost like this, and then you are doing small round strokes because these strokes mean you are putting too much force in one direction. But the small round strokes make it more evenly distributed.
So those people who brush as if they're fighting themselves.
No, they are really hurting their teeth. And if you ask those people, they would say they can't drink cold water.
I see.
Yeah. So when they drink cold water, it gets really sensitive. So they just do, normal room temperature water.
So it has to be circular.
Yes. Yes. So circular, the recommended is to come down a bit to remove any debris that could be within. But this is also perfect, doing round strokes. And one thing most people forget is that when they are doing the round strokes, I'll take my tongue off. I
wish we could all take our tongues off and brush them and put them back.
That would be perfect. No. So when you get to the front part of your teeth, you don't hold the toothbrush like this because the mouth is an arch.
Right.
So you may not be contacting the surfaces as well. You need to turn the toothbrush up and then go up and down the inside. So the insides of the teeth have a lot more deposits than other places, okay? Because saliva glands open up here. Okay. Saliva to deposits around your teeth is like water to cement. Once you mix it, it hardens.
Okay.
So saliva hardens the deposits. Yes, saliva washes away the deposits, but then the ones that are not washed away and are not brushed off properly tend to harden. Okay, so you want to clean this area, okay, and then also for the top parts, do up and down strokes in this way. And another thing I've noticed is most people don't know they have to clean the insides here as well.
Okay, that spot is very soft. So if your brush is too hard, it means that you can't do any meaningful work there.
Exactly. You don't want to be using a hard toothbrush at all.
Okay. What about the upper mouth?
Yes. So the
roof of your mouth.
Yeah, the roof you can. Well, yeah, if you can do some small, cleaning of that area, but it doesn't trap dirt as much as the tongue.
Okay.
As for the tongue, you really have to clean.
Take your time.
This place is more traumatizing because you may hurt your gums.
How long do you have to spend to brush your tooth?
So you should spend 2 minutes brushing.
2 minutes.
2 minutes,
And
maximum 3. But I shouldn't go beyond 5 minutes. You're on a call, you're still brushing, you're in the same area. Every morning, maybe you're rushing to work, you're just in that same area. You even tend to forget which parts you haven't brushed, So you should spend 2 minutes brushing your teeth twice daily, and you should floss at least once a day.
Okay. How much toothpaste do you need?
So for toothpaste,
it's a big debate.
Yes, exactly. So the brands will market from here to here.
Okay.
From
taking end to end.
Yes.
Okay.
Taking it
so
from
you can
end
start buying more.
And so it finishes early. But yes, you don't need that much because fluoride in toothpaste in large quantities cause some problems. So you don't want to be using too much fluoride when you can limit how much you use.
Okay.
So you just need a pea-sized amount of toothpaste, okay?
Okay.
So just about this much.
Oh, I see. So you
just
don't
about
need,
this much.
You don't need the whole thing.
No, you don't. You really don't. And one thing that you also don't need to do is you don't need to rinse out after brushing.
Tell me more. We have to go, but I'm interested in this one. So you finish brushing?
Yes, you finish brushing. You want the toothpaste to work on your teeth, and then you rinse everything out. It doesn't even have time to do anything.
It costs 90.
Yeah, exactly.
I see. So you should leave some in there.
No,
but
so
it's
you should brush, right? And then you should spit out.
Okay.
So the sequence is floss,
okay,
because it removes the deposits from in between your teeth. Rinse your mouth, because now you've flossed, you've taken out the deposits.
Right.
You rinse your mouth, and then now you brush.
Okay.
And then after brushing, you spit. So there is rinsing, but it's rinsing earlier than the brushing.
So
rinsing to take off the deposits, and then brushing and spitting out.
Okay, so sequence is that I go into the bathroom.
Yes.
And then I floss first.
Well, especially at night. Let's say you can't do it in the morning. We'll take once a day. So once a day, you've flossed. So at night, before you go to bed, you floss.
Okay.
Rinse your mouth. Because now you've pulled things out. You've shaken things around. So you rinse your mouth. And then you use your toothpaste and your medium toothbrush, and then you brush for 2 minutes, and then you spit out.
Okay, I see. Okay. Some of the brushes are very, very long, like almost two inches.
I know, I see those ones, and funny enough, a lot of people buy them. I don't know how they have access to all their teeth, because there are some areas where you even have to close a little to be able to reach.
Right.
So if your toothbrush is so long, how are you getting there? Something like your wisdom teeth, you need really small headed toothbrushes. Sometimes we even advise using a baby toothbrush to be able to get there and clean it properly. So if your toothbrush is so long, you really aren't touching all the surfaces that you want to get to.
I see. That's your camera right there. I give you 30 seconds. What's on your mind to tell the Ghanaian public in terms of tooth care? We've spoken extensively, but what are your closing thoughts? That's your camera right there.
Okay. So what I'd like to tell people is, you don't have to wait for pain to visit the dentist. It's almost like going to, get your hair done, your eyebrows shaped. You want to visit the dentist when there's no pain because you don't want to go through any discomfort. And there are things that you don't know you are doing that could be harming your mouth, the rest of your body, because the mouth is the gateway to the rest of your body. So I'd advise, and many Ghanaians are proud to say this, they've never been to the dentist. I'd advise that, you put some, it's not even about costs. If every month, because it's, twice a year, so 6 monthly, if every month you put something small down towards your oral health, by the time it's 6 months, you can easily afford a cleaning.
Right.
So please visit your dentist. We are equally as important as other healthcare professionals, and we see a lot more that you don't think we do.
Dr. A.C. Afful, I'm grateful.